I'm going to go on a little bit of a rant today with kids, adult. I mean, she's 31, so an adult. But it's been like this since birth because she's been handicapped since birth. So she's never been verbal. She's never been able to communicate other than making facial expressions and watching vital signs. It's very difficult to express what I think is going on to a doctor of any kind, the neurologist, the primary care, who is a complex care in a major medical hospital. Um, this past week, Taylor has been showing me that she's in pain, and I was giving Motrin, I was giving Advil cold and sinus, I was giving tobramycin, which is an aerosolized antibiotic that treats what's in her lungs, and that was based on the ENT when he did a trach tube change, scoping her and saying he saw some red areas in her trachea. So I did that for 5 days. She was still doing her flinching, the flinching that the neurologist said was not seizures. So it looks like when you give a child a lemon, and they take that bite and they go, kind of thing. She makes that face. And it also involves her body just tenses. Everything just tenses up with it. And then it just goes away. So during it, she's showing me eye contact and following me a little bit with her eyes, which is why the neurologist did not feel it was seizure related. I think it's pain related. So the ENT also at that trach tube change appointment said her ears looked better than they have in a long time. So I didn't consider the ears, even though typically I would. Eventually I did. I started giving the powder again, just to see if that could help. This whole time I was communicating via my chart, with her primary care doctor, and his advice was to give her rescue seizure medication, or diazepam. You just want me to drug her and see if it'll interrupt what he felt was seizures, even though nobody else did. I sent him a video clip of what it was looking like. So he looked at it, said he thinks it's seizures, and wanted me to give the rescue. Problem is, if I would have taken his advice, I would have been drugging her every 2 hours with diazepam. There's no quality of life there, and I wanted to find the cause. I wanted to find the lemon. I wanted to find the reason that she's making these responses, and I wasn't getting anywhere. And trying to take her to the emergency room, whatever resident is there will misdiagnose it and call it pneumonia, and next thing you know, they're wanting to give her IV fluids, which overloads her lungs, and heaven forbid she gets tachy, heart rate high, and then they can't get a good blood pressure and they call it low, and next thing you know, they're calling a sepsis code, and it's very predictable. And I'm glad they have protocols in place to help kids when they need it. It's not helpful for us. And when I take her in and I say this is what I think, I'm not listened to. And I don't know how to fix that. I've tried for years. I've tried. No luck. I get the, Mom, what we think is, Mom, you don't want her to. Mom, and it's just, So my fiance gave me a little trick to try. It was a skit from, I don't know, not Saturday Night Live, but one of those kind of skits that to kind of ease my frustration a little bit, that when I see them walking through the hallway, I kind of put them between my fingers like this, and I squish your head. It worked. It helps some. If you know where that's from, please feel free to tell me, but I don't remember. It was some kind of comedy skit. So Friday, yesterday, I went to clean her ear and give her the drops, and just blood, a lot of blood everywhere. And so I called to try to get her into primary care. That was not happening. I didn't want to go to the emergency room because she wasn't showing me anything else. No fevers, nothing else, just all this blood coming out of her ear. My suspicion was that her eardrum burst from some type of infection in the middle ear, that I either couldn't quite get to with the powder, or didn't start it fast enough, or it wasn't ever going to be enough. I don't know. So I did get a hold of the ENT, and they worked her in for a same-day appointment. On the way there, I ran over something in a construction zone. That's Ohio for you. And it blew the front tire. So front tire's gone. It's a handicap accessible van, and she's in her wheelchair. I really don't have a good support system around me on who to call. So I'm in a bad area of town because I followed my GPS instead of going the way I normally would. So I end up having to call an ex-boyfriend, and luckily he was still kind enough to come help, and he changed the tire and he got me a new one, and I'm extremely grateful for that. We also missed our appointment, so we came home without that appointment. So I called in, and nobody was answering. So I was able to get a hold of her primary care through my chart, and he said as long as she's not showing any other symptoms, to just keep her home and monitor her and try to get her seen on Monday. He didn't offer up an appointment, mind you, but just try to get her seen on Monday. Okay, thanks for that. So I called ENT back like 5 minutes before they closed, and I was able to get an appointment for her for Monday with her ENT. But since the bleeding episode, she has not had any flinching at all. None. She's showing me smiles again. She's nothing. So she must have been in so much freaking pain that I was not able to stay on top of. I called the pharmacist and said, how often can I give this? How much Motrin can I give? How can I manage her pain better when I'm not? It was just, I felt so bad for her, and I'm very glad that she's feeling better. But it just goes, if she were screaming her head off, somebody would see her. Somebody would take it seriously. She can't cry. She can't scream. So nobody listens to either of us. Am I supposed to scream and cry for her? Nope. They'd call social work down. So that wouldn't be a good idea either. I had a doctor once when I had her into physical medicine, trying to get a wheelchair seating clinic appointment, but she was osteopenia, which is the brittle bone disease type thing. So she was having a few fractures, just from positioning and moving her around. There was a drug that they had offered up, that you have to give it in 3 consecutive days over 3 hours by IV. And it had to be monitored, because if it went in too fast, she could go into cardiac arrest. So I did agree to it, because it was supposed to help her bone density, and she would not have fractures if that were the case, and it worked. Problem was, it was still in a trial phase, so they had to get it all approved by the doctor, and then I wouldn't agree to taking a healthy child into the hospital for 3 days. So we did get a nurse practitioner to come to the house along with the RN to administer the medication. But the doctor had told me, you should consider yourself very lucky that people are even interested in helping kids like yours. She meant it. They all mean it. They just don't always say it. So I said, your drug is in trial. You should be grateful that I'm allowing my daughter to be in your trial. And then you leave. And you go home and you drink a glass of chocolate milk. Tastes good.